In this class, we are going to learn about inguinal canal. See, this is not very much important in female, so it is usually present above your inguinal ligament. So, what is the importance is that it in male it has a lot of importance. It carries the spermatic cord, but in female, only the round ligament which is attached to your uterus passes through this inguinal canal and comes and gets attached to your upper part of your labia majora. Okay, and one more thing is that this is lined by the out pocketing of the peritoneum, which is known as processus vaginalis. Along with that, it has abdominal muscularis. So this structure is within the abdomen. So I've just explained it to you all. Now let's see the blood supply of the anterior abdominal wall. This blood supply is very much important. Okay. So the blood supply of the anterior abdominal wall has been divided into superficial and deep supply. So superficially it is supplied by the femoral branches and deep supply is through the external iliac arteries. So what are the branches? The femoral branches are your superficial, epigastric, superficial, circumflex, and external pudendal. Okay, deep by the external iliac, the branches are your deep epigastric and deep circumflex. So see what happens is see, if this is your umbilicus, this is your pubic symphysis. Okay, umbilicus, and this is your pubic symphysis midline. Now you must have heard about something called as Hasselbalch's triangle. This is your Hasselbalch's triangle. Next to the Hasselbalch's triangle, that means the lateral boundary is formed by your inferior epigastric artery. Okay, so why I'm drawing this is I just want to explain you the course of this inferior epigastric artery. Why it is important? Because it's important during your laparoscopy surgeries. See here at the level of the pubic symphysis, the distance is around 5.5 centimeter. Here also 5.5 centimeter lateral to the pubic symphysis, and then it goes medially, and at the near umbilicus it is around 4.5 centimeter from the midline. Why I'm telling this? Because while cutting through during cesareans, the incision size will be around 10 centimeter. In this 10 centimeter, you are not going to injure your inferior epigastric artery because it's a very vascular supply. If you cut through this, the person is going to bleed a lot. To avoid that, we give incision within this 10 centimeter. If you extend beyond this, then there is a chance you are going to cut the inferior epigastric artery. Okay, and here while putting ports also, it's very important for you to know the location of your inferior epigastric artery. Here near the umbilicus it will be 4.5 centimeter lateral to the umbilicus or the midline. So that is very important. So basically this inferior epigastric, it goes behind the rectus sheath. Okay, behind the rectus sheath and goes behind the rectus muscle. Now coming to the innervation. So I'm just going to add a color. Innervation. So the nerve supply for the anterior abdominal wall, we have divided them into T7 to T11 intercostal nerves, T12 which is also called as subcostal nerve, and L1 which is your ilioinguinal, and it has two branches, ilio-hypogastric. Okay, so ilioinguinal supplies your lower abdominal wall and upper part of the labia majora and inner part of thigh. Why I'm telling this? Because it's very important when there is a labor pain transmission. Okay, so it radiates from one part to the other. Then iliohypogastric, it supplies your abdomen till the pubic bone. Okay, so I'm just going to draw this iliohypogastric and ilioinguinal. This is your iliohypogastric. This is a pubic symphysis, and ilioinguinal will be like this, then going medially. This is your ilioinguinal. So this is the nerve supply and blood supply of your anterior abdominal wall. So with this video, I am completing the anatomy of the anterior abdominal wall in brief. So whatever these notes I am teaching, this is from the standard textbooks which I have read during my residency, and I have made notes out of it. So this will be very useful for you all if you are reading in the last minute, or if you're watching during the last minute of your exam. If for further reading, I would suggest you people to refer to standard book.